Hello, everyone, and welcome to our Tuesday evening introduction to LifeWave. I'm your co-host this evening, Robin Blank-Mascari, along with Gregory. We get to share a little bit about this very special company, the technology, the founder, the timing, the technology, and then we bring on a special practitioner. This evening, we have Dr. Stuart Freedenfeld to join us, and he'll share for a little bit, and then we'll bring you guys on, and it's your opportunity to share your stories, ask questions. Please use the Q&A, and remember, symptoms only. And no mentioning or naming of those things and diagnoses, because we won't answer those requests, just so you know. We love staying compliant and really appreciate that. And a special warm welcome for those of you that are brand new and checking out LifeWave for the first time. This is a perfect place to be. So thanks for being here, and let's jump in and get started. And Gregory's going to do a very short presentation. And there's some wonderful light coming in on you.
That's
yeah. You're on mute, I think.
Oh,
there you are. Okay.
Okay. Good.
I'm going to turn it over to you.
Great.
And I'll be back.
And I'll be here, and I'm going to go ahead and share my screen. So hold on, folks. And good evening, and welcome to our call for LifeWave and X39. And I'm very happy to be able to share some information with you here tonight. Before I do, I wanted to share with you kind of an awakening I had a number of years ago. I finally figured out what I want to be when I get older, younger. And I don't know, I'm sure many of you can relate to that. And before we get started, I'd like to ask you a personal question. If anything were possible, what is one thing you choose to experience differently in your health or in the health of someone you love and care for? And what difference would that make for you or them? And we just might have a solution for you. I do want to just put a disclaimer up front that our products are not designed or intended to heal, treat, or diagnose any disease. They do, however, help put our body back into a more healthy, regenerative mode, and many things wonderful start to happen. So welcome to the stem cell revolution, because we believe everyone wants to look, feel, perform, and live younger. And we found that stem cells are the key because they're a vital part of our immune system that repairs and regenerates damaged cells. Now, the problem is, the older we get, the less stem cells we have, the less active our stem cells are. And by age 60, only a small percentage remains. And sadly, the fewer stem cells we have, the faster we age and the slower we heal. And neither of those things sound very cool to me. So what about stem cell injections? Because they become quite popular, but they're also quite expensive. They can be painful, risky, controversial. And you know what? You can spend thousands or tens of thousands of dollars with no guaranteed results. Well, tonight we've got some really good news for you, because you can look, feel, perform, and live younger with our historic breakthrough in stem cell activation. It's a new wearable technology in patch form. It's affordable, it's safe, it's non-invasive, it's drug-free. It's a patented form of phototherapy that uses a specific frequency of light to increase and improve stem cell activity. And this is the brainchild of our visionary founder and CEO, David Schmidt. And David is not only a brilliant scientist and researcher, he's a genius inventor with over 130 patents and patent pendings. And he's been on the leading edge of phototherapy research and science for over 20 years. And over this time period, David has already conducted over 80 clinical studies proving the efficacy of LifeWave phototherapy products, and many more studies are in the works. And so LifeWave as a company is a 17-year-old advanced technology company focused on health sciences. It was founded in 2004 based on an energy-enhancing technology that David developed for Navy SEALs to increase their strength, their stamina, and their performance without the use of drugs, stimulants, or caffeine. This particular technology became so effective, it's now used by world-class athletes around the world in almost every sport. We now have corporate headquarters, laboratories, and manufacturing in California, Utah, and Ireland, with global distribution to over 75 countries from our 15 global distribution centers. And certainly the word is getting out. And I said, LifeWave patches are now used by pro and amateur athletes around the world in almost every sport. and the media has begun to notice, and you might too, if you look and you see some of these auspicious little white patches on the bodies of some of your favorite athletes. Well, let's talk about how this amazing technology works. And it certainly is a breakthrough technology, and it's based on a type of light therapy called photobiomodulation. And our LifeWave patches contain very specific combinations of organic materials and nanocrystals. And when they're applied or near your body, they're activated by our body heat, and they then begin to emit very specific wavelengths of light, which stimulate targeted and beneficial biochemical responses in our body. This is known as photobiomodulation, and it is the basis of our LifeWave phototherapy patches. And so it's been a well-recognized and proven scientific principle that specific frequencies of light can cause very specific changes within our body. For example, when we go out in the sun, a specific frequency of light causes our body to make vitamin D. We don't get a download of vitamin D from the sun, but we do get a download of a frequency that tells our body to manufacture vitamin D. Another frequency of sunlight, UV, causes our body to make melanin, the chemical that gives us a suntan. And I was out in the sun today and I got a little bit of that download. And LifeWave's patented technology is based on the same rock solid, well-recognized scientific principle. Our focus for the last 14 years has been in the field of anti-aging and regenerative science. And in January of 2019, a little more than 3 years ago, we released to the global market the LifeWave X39 stem cell activation patch. And this truly is a historic and affordable breakthrough in stem cell activation, because some are calling it the holy grail of anti-aging restorative science, because we're actually doing what the multi-billion-dollar companies and big pharma have not been able to do. And X39 activates a very specific copper peptide that activates our body's own stem cells while also altering gene expression towards a younger and more vibrant you. And so X39 truly is a game changer, a true breakthrough. And our founder, inventor, and CEO, David Schmidt, this is my greatest achievement yet, with the emphasis on yet, because David spends more time in the laboratory than in the office. And wonderful things are going to become, many wonderful things are going to be coming out of that laboratory. And yes, we have patents. Yes, we have clinical studies. Yes, we have field results proving that X39 is actually turning back our biological clock, helping people to look, feel, perform, and live younger. And for us baby boomers, this is very exciting news. So with that being said, Robin, I'm going to turn the rest of the call back to you and our good friend, Dr. Freedenfeld. So thanks very much for.
Well, thank you, Gregory. And if you can promote Dr. Stuart to co-host, that would be wonderful. And let me introduce him properly. We are blessed to have so many great practitioners involved in LifeWave, and you're going to hear reasons why in just a minute, but I want to introduce Dr. Stuart. He is an MD. He did his 3-year residency at the Hunterton Medical Center and was a chief resident there, and board certified and a diplomat in family practice. And then he went on to be an instructor. He loves traveling all over the world and being an educator. He was also president of the Hunterton County Medical Society for several years and instructor at Rutgers Medical School. Then something interesting happened in 1988. He broadened his horizons and he started studying herbal medicine, nutritional therapies, homeopathy, and he started offering his patients a combination of things to support them on their healing journey. And he's just taken, studied hundreds and hundreds of hours to really give the best of what he's learned to his patients for them, and has become an expert and respected international lecturer in the areas of autism, ADD, ADHD, detoxification, and many of the other afflictions known with aging. Sound familiar, you guys? So we are thrilled to have him as part of our team, and he has many areas of expertise. I kind of think of him as like the oldest person on the soccer field. And he's going to share that with us because he just got off the soccer field I'm going to let him tell you how young he is. So Dr. Stuart, you want to join us? There he is. fresh off the soccer field?
Yeah.
Are you fresh off?
Um, Not the best lighting. Sorry about that.
That's
you hear me?
okay. We can hear you and we can see you, and we're glad to have you because I know you snuck out of the game a little early to be with us, right?
It was difficult. We had no subs tonight, so
Oh no, you had to work extra hard.
I had a,
And you're probably the more mature one on the field, correct?
I am the senior member of our team. Yes.
The elder in the bunch, yes? And you're playing with kids that are how old?
Well, this is a league game, and they're in their 40s and 50s. I'm the only one in the 70s. I'm 73 and a half. On Sundays we have an open field, and we play with 20-year-olds and try to keep them on their toes.
I love it. So I hope everyone is hearing what we just heard. And now Dr. Stuart is 73 years young, and he's playing with the kids. And there were no subs. And how are you feeling right now?
I feel great. It's my stamina is remarkable.
Beautiful.
Been so much better with these patches that we're happen to be talking about tonight.
So that's actually the first question I like to ask is, what got you as an MD interested in even exploring the possibility of this technology called LifeWave?
Well, as in my career, I looked at a lot of integrative medicine, a lot of people call alternative approaches to healing, basically working with the body's mechanisms. And this is one of those things that was presented to me, and I, in my open-minded skepticism, I decided to give it a try, and was really, really impressed with it. I started with X39, and my pain levels, I had some low back pain at the time, just improved within an hour. It was crazy. It was, I felt like that just placebo effect. Can't believe that. But using it as the days go by and the weeks go by, and my stamina improved, and most important, my recovery time improves. I work hard. I do a lot of heavy work in the garden and around the house and on the soccer field and in the gym. And I really like not having that achy lumbago pain all over my body that was part of being an active individual. So it's just so much.
That's great. I love healthy skeptics. They're one of our favorites because once they dig in and look, it's pretty wonderful. And I love that you're getting great results and continuing to feel younger and younger and be out there in the field. It's fabulous. Okay, so now let's jump into X39 and the patch and the technology. Who is this technology for? Who is the X39? We call it our stem cell activation patch. Technically, it should be called the GHKCU patch, but who's it for and who's it not for?
So, we always look at the stem cell, which is probably the most important effect of it, but it has other effects too. It rejuvenates over 4,000 genes. This has been published studies. So the age and toxicity related changes that occur in our genes get rejuvenated, made back like they were when we were younger. It increases certain amino acid production. So we get more branched chain amino acids to help heal tissues. We get GABA to help with our anxiety levels, and tryptophan to help with depression and sleep. So just lots of things change. People that are impaired, that have injuries, that are dealing with issues, they're certainly going to gravitate to something like X39 and other patches and other supplements because they're trying to get themselves healthier. But I think there's also a role for the young, healthy person who wants to go through life without the degenerative changes that are bound to occur. And just to give a little bit better edge and keep our bodies more youthful and crisper, and even our skin healthier, and on and on. So I think that anybody could benefit from it.
Beautiful, beautiful. So these lucky 20, 30, 40-year-olds that won't have to go through the degenerative phases that some of us got to experience to turn it around. And so what's the ideal conditions for getting the greatest benefit about using this product? What should we, how does someone use it?
So I think that when we're looking to improve our health, it's important to make it as easy for our body to improve. We want to eat healthy food, drink good fresh water, take appropriate supplements, get sunlight, discharge animosities and anger, and live in the present moment and not in the past and the future. So to get the best out of our body's ability to heal, be a healthy individual and give it a chance. If we have to swim upstream, don't let the stream go stronger.
It's so beautiful. And our founder, David Schmidt, talks about that also. The patches do amazing things, but we have to do our part. And I love the way you talk about living a healthy lifestyle. It's not just hydration and food and movement, but it's, the emotional components also that can make a huge difference in the quality of our health. So if we do that part, then how long do we wear these patches? And, anything else we need to know about using them?
So I put my patches on in the morning, and I take them off in the evening. We typically talk about a 12-hour span, but I'm not uncomfortable if I leave it on for 14 or 15 hours. I think it's important to take them off and give your body a chance to prepare. It's like if you pull on a rubber band continuously, it stretches out, and it's not going to do anything when you let go. You want it to be able to snap back, and that's what our body wants to do when we're getting a photobiomodulation, a light-induced effect on our body. We want to have the body ready to receive that induction.
I love that. That's beautiful. By the way, I haven't seen you in a while. I've missed you. It's nice to have you back. Thank you. Yeah, we had some.
It's been much more time than normal.
We had some schedule changes and some recordings and things. So I'm just glad to see you again.
Thank you.
I get kind of attached to our docs, Yeah, I mean, we have a very special group of people that are affiliated with LifeWave. So as far as what can people expect, Dr. Stuart, when they're using the patches? I mean, how long before they notice something? Is there any kind of guidance on that?
When I used it, I had immediate and dramatic results. Patricia had very rapid results. In a few days, she increased her maximum biking distance from 8 miles to 16 miles. She resolved a chronic, I can't use the word, neuropathic, nerve-involved pain in her feet.
Good job.
that troubled her for 12, 15 years. And it wasn't overnight. After 6-7 months, she's back hiking and walking and no longer troubled by it. Not completely gone, but she's about 70% better. And it's just remarkable for her. So some of the things may be very rapid, and some things may take much longer. I would recommend anybody that wants to give it a go to give it 2-3 months to be sure that they begin to see what results they are. And we don't know what those results will be necessarily. Our body's determination where to heal.
That's a great answer. So it could be anywhere from instant to months.
Yeah.
And so I like to be conservative. And what you just said is give it several months, keep yourself well hydrated, give your body a break from the patches, 12, 14 hours on off, and be consistent. And the beauty is it's cumulative. It just keeps getting better. So we do recommend that everyone use a health tracker and have the person who invited you give you a health tracker so you can get a good baseline and know what kinds of things to pay attention to, because you may not realize that, a patch that activates your stem cells can actually help you sleep better, or, have mental clarity or mobility or pain. There's so many benefits and everyone's different, but pay attention to the little things, because little things change over time. And if you have any scars, take a picture. We recommend you take a picture of your face in very good lighting, because your body will produce more collagen and those fine lines and wrinkles are going to kind of disappear a little bit. So really fun stuff. So any other final comments before we open up for some questions about anything you want to share about the amazing X39?
No, let's go to questions.
Okay, let's start out with, and so the questions are in the Q&A, everyone, and thank you for mentioning symptoms only. So doctor, I just had new lens surgery. What patches and placement would you recommend? Also, what patches do you recommend for calf leg cramps at night?
Let me start with the leg cramps, because I have a lifelong issue with muscle cramping, and I've been an athlete all my life, and have suffered with horrible cramps. I've used lots of things to help control them, carnitine and magnesium and ribose sugar, but the energy enhancer patches has been such a game changer for me. It was routine for decades that after a game I would wake up in the middle of the night with severe muscle cramps, and I had to suffer through for an hour of easing them up. Since the energy enhancers, I don't get them. It is blows me away. It's so pleasant to sleep through the night after a game and not have that pain.
So do you put them on your feet?
No, I just put the energy enhancers in the standard spots, white on right, left, tan on the left. It makes my game much better, my gym time much better, and I don't get the cramps.
That's exciting.
The other, if this was lens surgery, did I hear that?
Yeah, a new lens.
Yeah, there are protocols for eye patch placement, and maybe you have that easier than I do.
Sure. Because you just had the procedure, I would just stay with X39 and see how things go. Carnosine is made in the eyes, and a lot of people find that very helpful. But since you just had the lens surgery, it sounds like, Glenn, you should be in good shape, and the X39 will keep you that way. So I would just stay with that. If you're noticing any kind of decline, you might want to add carnosine, and you might want to put it in a sleep mask. You can put it on the top of the mask during sleep. You can put it on the temples, or you can put it under the mask between your eyes and the mask. But you should probably just fine with just X39, and notice that your eyesight will keep getting better and better. Yeah. Okay. So, and the leg cramps, actually lots of the different patches work for that. So I sleep with it Eon on the top of my spine, and if I get a leg cramp, I'll just grab it from there and I'll put it on my leg, and it's handled. So lots of the patches work for lots of things. It's good to know, because when you're sleeping, being woken up with cramps is really, really difficult. So it's just, one night I chomped on my inside of my mouth when I was sleeping, and I just took the patch from here to here and went right back to sleep.
It's interesting because as when I started getting into these patches and getting more and more interested because it had such good results, I got all the different patches and I just began to play with them. And you're right, we could, an individual who buys an X39, they don't have an Eon patch, glutathione patch, a carnosine patch to play with, but there are just very interesting combinations and placements that can be fun and very, very helpful.
Yeah. And you use what you got because they it's amazing. Okay. Casey says, if a family has a history of many deaths due to debilitating disease, which they have been told is in their DNA, notice that, told in their DNA, can current members of the family do anything preventative? Good question, Casey.
I would want to know more about what the diseases are. Are these cancers? Are these cardiovascular diseases? Neurodegenerative diseases? So if we can be a little bit more explicit, Casey.
Okay, without mentioning disease names. And, what I've learned is, a lot of people don't know about this new technology. And so it can, things that many people say are impossible are no longer impossible. So just know that we don't have to buy into what we're being told either. So Casey, why don't you give us a little more information? And X39 always. It's just kind of the answer. It's kind of like in medical school. What does this, and this? It's always the liver, right? How many functions does the liver have? Like 17,000 or something crazy. I don't know. It's a lot. It's a lot. So, okay. Someone anonymous said, I had a vehicle accident 10 years ago and a disc replacement in my neck. And now I've started to have degeneration there. Will X39 help? I'm starting to have pain on my neck after I fell about a month ago. Which patch would I use? Will it help my condition?
So yeah, I would certainly try X39. May want to even consider adding X49 to help with the degeneration. I think with chronic area injuries, glutathione can often help just to detoxify the debris in that area. And Eon, that you had mentioned before, is a great anti-inflammatory. Inflammation is how we heal. So when we take the pharmaceutical anti-inflammatories, it's actually blocking our healing. Whereas using a natural anti-inflammatory, it's removing the inflammatory debris, the stuff that causes pain, but it doesn't impede the healing.
Beautiful. I hope everyone heard that. That's a really wonderful distinction, that the pharmaceuticals actually block things and the patches actually get rid of the debris, but allow the body to do what the body does naturally.
Yeah.
And
there's a reason pharmaceuticals are by prescription only, because they're dangerous. I mean, I sound dramatic if I say they're poisons, but they poison the system. They block biologic functions. Yeah. So we're looking more in an integrative medicine and healthy medicine to support the body's healing rather than block the things that cause us symptoms.
That's so wonderful. Our pain patch is not stopping the pain by blocking it. It's opening up the energy flow so things can actually heal. That's beautiful. So X39 is a regenerative patch. And notice that you have a degenerative situation. So put the pieces together. I think you're going to get some great results. Wonderful. Well, the next one is leg cramps again. So I think we covered that. So lots of things we can do for leg cramps. You want to say more? Sure.
Somebody told me this as a physician many years ago, and then it was repeated by several other people. They said when they get leg cramps that they would put a bar of soap under the sheet by their leg, and it took the cramps away. I've never personally tried it. I don't get those kind of leg cramps, but it's been repeated. Quinine also helps, but
it's fun to learn all the things that can help and try them all. and see
Yeah.
what works. And that's another thing about the patches. I was talking to one of my new people today, and I said, trust your instincts. And I gave her some guidance for where to put the patches. And then she started moving them around and she got even better results. And so
Exactly.
really trust your instincts. You can't hurt anything. They're non-transdermal. Nothing is going in your body. So there's no contraindications and it's safe. Yeah. Okay, Francine says, I am sleeping like never before and certain pains are gone. I'm willing to tell my story. I'd like to know if it can help with an infection in a bone.
An infection in the bone. Ah, infection in the bone. Well, if you can get into a hyperbaric chamber, that's probably one of the better ways to clear that up. Intravenous ozone will also get to the bone for healing. As far as the patches, well, we could always say X39 does everything for everybody. And a glutathione may help the body deal with the infection as well.
Great. As for those that don't know, glutathione enhances our immune system. And when you have an infection, you want a strong immune system, right? Okay. Desiree's asks, what does David Schmidt say about heavy metals? Do you know what David Schmidt says about heavy metals?
They're bad.
I
Bad.
agree. Yes.
Yeah, they're bad. And there are ways of getting rid of various heavy metals. Some are by different types of treatments. One of the more difficult ones to get rid of is aluminum, and carnosine does a good job of binding to aluminum and removing it. The carnosine patch should be a nice adjunct to that. And that may be why it's helping with the neurodegenerative conditions.
And always adding X39, right?
This is like your basic soup stock is
Yeah,
X39.
that's it. It's soup stock. But yeah, and heavy metals. And another time, I look forward to talking to you about detox because I've been getting quite an education lately, and having something that's a binder is a helpful thing because activating it doesn't mean it's going to all leave your body. So having something that binds to it to get it out is what we're looking for. Great.
We could do about 2 hours on heavy metal detox if you'd like.
Yeah, really. Yeah, I'm at that stage in my 4-month detox program right now. But we did clearing the pathways first, then we did parasites for a month, then we did lymphatic cleanse for a month, and now we're doing heavy metals. So we worked up to heavy metals. Yeah, it's a process. Okay, Jennifer says, I have a couple of customers and a couple of friends that are dealing with long-term struggle with joint pain, stiffness, and swelling, sometimes numbness and tingling. A couple have had numerous joint replacements. One customer had relief in her forearms, wrists, and hands. Beside X39, what would you recommend for them?
I love the X39 for joint pains. The nerve stuff, I think Eon is a nice addition. Glutathione is a nice addition. Carnosine can also be very helpful there.
Beautiful.
I'll try to apply the patches to the joint involved if it's limited. So we can, if it's both knees, for example, you put the glutathione on one knee and the X39 on the other knee, and the next day switch them.
Great idea. Great idea. Love it. And hydration can really, really help with a lot of joint pains, and a lot of people need more water. Wonderful. Okay, so Jerry says, let's see, there's tingling and lack of sensation in foot situation. Where would the patches be used?
Is it in one foot or
I don't
both?
want to mention the name of the.
So
Didn't say.
One way of dealing with that, when Patricia's neuropathy, her nerve pain, whatever, I can't jump around these things too much. She,
Nerve
when
pain.
her
Nerve
feet
pain.
were hurting her a lot. We overdid it. I'll take the ice wave and put it on the balls of her feet, the white on the right foot and the tan on the left foot, and that usually gives her a nice night's sleep, where she used to have to take narcotic pain reliever.
Great. And we've heard lots of people that have, nerve situation in their feet with numbing and pain, that the combination, like Dr. Stuart just mentioned, with an X39 will help regenerate some of those nerves and things get better. So great, thank you. Judy wants to know, how can the patch help with nerve damage? This must be the nerve night here.
Yeah.
Nerve damage from from a past rash, and it's been 6 months and still have pain where the rash was.
Yes. So this was probably related to a virus that caused a rash and leftover nerve pain. Yeah, these can be difficult things when they go long term. I would again use the glutathione and eon along the nerve root. You could try playing with ice wave, putting the tan patch in the point of maximum pain, and playing with the white patch in a clockwise fashion, trying to see where it gives the best pain relief. X39 right over the pain area as well.
Beautiful. And like we said earlier, try it and then move it around a little bit and see how you can get the best relief. Sometimes people use medical tape or a Band-Aid and let it sit in a different location and try different things until you get the results you're looking for. Okay, I am trying to find Dr. Linda, would you please raise your hand so I can find you, and then I can open up the line so you can share your story? Okay, because Dr. Linda wants to do a quick share. So why don't you raise your hand, and then I'll open up the line for you. And so Valerie wants to know what to do with stiffness and aches and pains in the knee.
Yeah. So, a lot of people talking about joints and X39, all these patches, we've said the same things over and over again. But the joint is, the wear and tear damage to the joint is wearing down that cartilage surface. To rebuild the cartilage, we can get the bricklayers to lay their bricks faster, but they need to give them bricks. So taking a good supplement of a good quality glucosamine, and if a micronized chondroitin, because chondroitin is not well absorbed, but primarily a good quality glucosamine, so that the joint can begin to repair the cartilage.
Great. Yep. I had amazing joint relief from X39 from a bone on bone knee in a week. I put it here, and a week later my knee pain was gone, and all the rest of my joint pain was gone also with just X39. So pretty exciting. And then we have other things that can help too. Thank you. Okay, Chris wants to know, she's got a customer in her 80s who's losing her eyesight due to a condition that makes her lose her center vision as it spreads out. What would you suggest?
Yes, there was some work done in Cuba using intravenous ozone for that type of a problem, with some very good results. I would certainly try the eye patching procedures with X39, glutathione, eon, maybe carnosine as well. But if she can find a practitioner who can give her intravenous ozone, that would be a good suggestion.
That's good to know. And notice that ozone is a very powerful healer.
It is the probably the most powerful healer I've run into in my 45 years in medicine.
There's a clue. I hope everyone heard that. And there's more and more places that are offering that as a form of treatment. So great. So Valerie's new. She says, "What do you mean by white and tan?"
So some of the patches have a 2-patch system, and one of them is white, the other one is tan. So that's what I mean.
Great. Great. Yeah. There's 2 different patches that are a 2-patch system, Valerie, and they're different colors. So, and when you get the sleeve, there is a divider in the sleeve on the energy patches and the ice wave patches. So make sure you look in both sides, and one is tan and one is white, and white goes on the right side of the body, tan on the left, most of the time, not always.
Play with
But
it. There's actually
get a help from your support system, okay? They'll help you. Tom wants to know, what do you think about double stacking of patches?
I've done it many times, and it seems to work just fine.
Great, great. It's there's an official, very technical term called pancaking.
Okay, which makes perfect sense.
Totally, totally. Okay. Do you have a suggestion for how to resolve hard, thick, deformed toenails?
Yes. I
Ozone.
well, yes, but no. Yeah, it probably would work. You can get a ozonated olive oil, which is like a gel, and you can apply that to prevent it from getting heated because the ozone will dissipate. But just take like a Vicks Vapor Rub, and put that underneath, work it underneath the nail as best you can, especially after a shower or bath. And after doing that for 4 or 5 days a week, the debris will begin to soften, and you can take your nail file and begin to dig out underneath the nail and keep working that. If the nail is really, really deformed, you may want to put the Vicks right on top of the nail as well, and the whole nail will just soften up, and it'll be easy to remove it. And try to keep it clear as the new nail comes in.
Okay, great. That's a hot tip. Good to know. All right, we got time for another 1 or 2?
Me, yeah.
Okay, great. What do you suggest for someone who got double vision after an eye surgery? Not good.
Well, if the eye surgery was a new lens and the lens is dislocated, they need to correct the alignment of the lens.
Okay, great.
If it's an eye muscle, the muscles will keep the eyes aimed in the right direction. So if there was a weakening of one of the muscles, that has to be corrected as well. And there are treatments by the eye doctor that can strengthen that. You can certainly try things like X39 to strengthen the muscle on your own.
Great. That's really good to do. And Valerie would want to know, are the patches better used at day or night? And when should you use them overnight?
Whenever you want. I experimenting is the best thing. I have used them overnight, and I've used them at daytime. Most of them I will use daytime. When I put my energy enhancers on for the game, I will wear them for 24 hours, just to prevent those cramps. Some of the things like, if I'm using an aloe vera patch, I'm going to use that during the night. So just experiment. I think your body responds well, and sometimes you may find overstimulation from a patch, and you may not be able to sleep. Other times, the patch at night will help you sleep. Experiment. Trust your body signals.
That's really good. I love the experiment. And, what I learned recently from David is carnosine can have can stimulate the mind And so for some people, wearing carnosine at night may be a bit too stimulating. Of course, the sleep patch goes at night, and you can play around with the rest. A lot of times people typically like to wear glutathione during the day because it does some detoxing, and that's when our lymphatics are, opening up because we're moving, because they have one-way valves. You might want to do glutathione during the day. Not always, but it's recommended. So play, like Dr. Stuart said, experiment and see what your body wants. I know people in Florida like to wear X39 at night because the sweat during the day is a hard time keeping it on, so they like to wear it at night. So you try different things and you'll find what situates best for you. So that person from earlier that had the family that had us the diseases, it was a disease of the colon. And so they're wondering what they can be doing to prevent what's happened to other people in their family that they feel is hereditary.
Going to answer this without knowing.
Yeah, we probably need more information. And I will say that we did a program with someone named Richard Davidson, and he talked about how to make your body unfriendly to disease. And it's in our Live Younger YouTube channel under the playlist 30 Minutes of Wisdom. And it's really about alkalizing your body and oxygenating your body, the things where disease doesn't like to live in places like that. But there's a lot of things that we can do to not fall into the hereditary patterns. Don't you think?
Yes, absolutely. Including some of the very severe and frightening diseases.
Yep. There's a lot of things that we can do to stay healthy, and we're not going to get into the details tonight, but regular detoxing is one of them, isn't it?
Yeah. If you want to give that person my contact.
Okay, I will do that. I don't know who you are because it says anonymous. So why don't you private message me and I will get you connected to Dr. Stuart so you can have further conversations. So Umberto wants to know, do the patches get old? Is there an end date?
I've never seen an end date. You would know better than I would. These are crystal structures, so they should be pretty stable for eons.
Okay. If you look really closely, you will find an expiration date on the sleeve, but because they have to have one, but I don't think they really expire. Like Dr. Stewart says, I found some that were probably in my drawer for 10 years and they were just fine. So we've heard that many times, but
there is expiration dates on pharmaceuticals, but that does not mean that the drug is not effective anymore or that it's old and should not be used. That to my knowledge, only one pharmaceutical that actually becomes dangerous when it's old, and that's tetracycline. Everything else, just keep using it.
Okay, great. And let's finish up with Nancy. Oh my goodness, Nancy. She had a total knee replacement today. Should I put my patches on now?
Yes.
I have X39, X49, glutathione, Ice Wave, Eon, and I want to heal. Yes, is the answer. And I will say, Nancy, my second knee replacement after being on X39 for a year and a half, I was off my meds, off my cane, off my walker in 3 weeks from a total knee replacement. Thank you, X39. Yeah.
Wonderful.
Pretty amazing. Okay, everybody. We want to thank you for taking the time to be with us. Thank you, Dr. Stuart. Wonderful to have you here this evening. Thank you, everyone, for being with us. If you're new this evening and you're checking us out, try it. There's no risk because the patches come with a 30-day risk-free guarantee. We have a wonderful customer program. And if you're the kind of person that likes to share, we have a member distributor program. So be sure to get back to the person that invited you, for all of you that are guests this evening and checking us out. And thank you for being with us. So good night, everybody. Bye-bye.
Good night, all.
Thanks.